Forrest Gogin is a psychologist at the University of Alabama. At least he was. He's probably still there. And starting in the late 1980s, he did a number of outcome studies on my book, Feeling Good, to see, did it actually have antidepressant properties? And he did a lot of clever and sophisticated studies. And the bottom line was he found that if you have someone who has a moderate to severe major depressive episode, you hand them a copy of Feeling Good and give them no other treatment, no pills, no psychotherapy, in 4 weeks, 2/3 of them will be dramatically improved to the point that they no longer want or need therapy. He's also done long-term follow-up studies, and they seem to maintain their gains. The studies I've seen have been up to 3 years so far following being given the book. But what happens to the other third, the people who don't respond? Now, I was also seeing this clinically. I've always had a number of patients who take to the tools, they do their psychotherapy homework, and have shown pretty amazing rapid recovery, but then I had other patients who would kind of yes-but me, and they didn't want to do their psychotherapy homework, and those patients did seem not to improve. And then finally, as I began to look at the outcome studies, not only on cognitive therapy, but on virtually every form of psychotherapy for depression, I began to notice that most of the schools of therapy are barely more effective than placebos. And yet this is something that people are not attending to. And I began to ask, well, why is that? What this 40%, say, or 50% of patients who just aren't responding in the outcome studies, why is that? And the exciting thing is we think we've discovered what the key is to therapeutic resistance and to people who aren't recovering rapidly.